Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Always great information. Joining us this morning is Dr. Mark Zaki from the Covenant Cancer Care Center. Thank you so much for being here. How are you, Dr. Zaki?
I'm doing great. It's great to be here. Thanks for having me.
We are so delighted that you're here. Thank you so much. We are talking today about radiation therapy. First, doctor, what is the role of radiation therapy in cancer treatment?
Radiation therapy is the use of highly energized X-rays to treat cancer. As you may know, there are three main options for cancer treatment: surgery, chemotherapy, and radiation. These treatments are often used in combination to treat cancer most effectively.
Sounds good. And listen to this, doctor. We have been celebrating pink and celebrating survival all month long for Breast Cancer Awareness Month. For women diagnosed with breast cancer, what are some indications they may need radiation therapy?
Radiation primarily serves two purposes in the treatment of breast cancer. First, it is a means by which patients can preserve their breast. And second, it prevents the cancer from coming back. Nearly all women with breast cancer will have surgery before radiation. For women who have a lumpectomy or removal of the cancerous tumor from the breast, radiation is almost always given afterwards, and we call this approach breast conservation. For patients who have to have a mastectomy or complete removal of the breast, radiation is given for certain high-risk cases, such as a large tumor or cancer involving the lymph nodes, where we think the chance of a recurrence is high.
That's very informative. Great information. Thank you, doctor. So what are some common misconceptions about radiation, doctor?
I'd like to take this opportunity to address two misconceptions about the use of radiation for breast cancer. The biggest misconception is the idea that patients have to remove their entire breast or undergo a mastectomy to make sure that their cancer does not come back. We know from several clinical trials and decades worth of data that breast conservation with a lumpectomy plus radiation is equivalent to a mastectomy in terms of cancer outcomes and survival. The second misconception that I hear quite often is, if my tumor has been removed by surgery, particularly when patients get a lumpectomy, that why do I need radiation? I think this is a very common question that patients ask, and I wanted to address it. I think it's important for people to know that despite having an excellent surgery in which the entire tumor is removed, often there are undetectable microscopic cancer cells still in the breast. The purpose of the radiation is to eliminate those microscopic cells so the cancer does not come back. And therefore, we still recommend radiation after lumpectomy removes the tumor.
I'm sure you put a lot of people's minds at ease with those two misconceptions. Thank you so much. So, doctor, what kind of technology does Covenant have for breast cancer radiation?
Radiation is really a crucial part of breast cancer treatment, but it also does have some risks, and that's why you need to have the best team in place and have the best technology in place to make sure that the treatments are not only effective, but also very safe. Our advanced treatment machines and treatment planning software are used to ensure that the radiation treatment only goes to the area of the body where we want it to go to, and to make sure that the dose of radiation is uniform throughout that whole area, such that there are no areas getting either too much radiation or too little radiation. We also have ways to make sure that the radiation does not affect other parts of the body, such as the lungs or the heart, by using specialized positioning systems or by controlling how the machine turns on and off during a patient's breathing cycle. All of these methods and these advanced technology methods that we have here are used to make sure that the radiation treatment that we give is not only effective in treating the cancer, but also very safe for our patients as well.
We'd love to hear that. And doctors, anything else that you would just like to say about Breast Cancer Awareness Month or cancer care in general?
Yes, I think during this month especially, we have our focus on breast cancer. It is very, very important for your viewers out there to know it is crucial to get a yearly mammogram. Usually we recommend this starting at the age of 40. This can be a life-saving test. The sooner that we detect radiation, obviously the more curable it is. So please get your mammograms and make sure you stay up to date on all of your healthcare screening tests.
Do not hesitate, do not procrastinate. Make sure that you get your mammograms. Early detection is key. Thank you so much, doctor, for joining us this morning. We appreciate it.
Thank you.
You are welcome. And for more information, if you like anything else about today's topic, you can just head on over to the Hot Links page. That's at WNEM.com.